tell me about the amount of implants for a snap-in set of teeth, and then how many implants for teeth that don't come out on the upper and the lower. Tell me how that works.
And I actually don't like snap-in teeth.
Why? The snap-in dentures.
I don't like them because the patients don't like them. Because it's still a denture, and it's not natural. It still covers your palate, and it doesn't offer many advantages over a regular denture. So 2 implants minimum for a snap-in denture on the bottom, and maybe 2 to 4 on top for a snap-in denture, and for fixed teeth on implants, we do as little as 4. So,
and when you say fixed teeth, what do you mean?
So these are teeth that don't come out. That's for snap-in dentures. We
so
still
they're
have
fixed
to take
in
them
place.
Out. Yes. And that's why a lot of our patients don't like the snap-in, because it's still a denture. And I like to say George Washington wore dentures 250 years ago. So I feel like the technology's gotten better, and there's better options available.
Now, why is it, especially here in California, why is it so many of the new dentists are pushing these snap-in dentures? Seems very popular, and you don't like them. So what's your take on that?
Well, it can be seen as a lower cost option for people, and it can be viewed by some clinicians as an easier option to do, because you don't have to invest in technology to be able to make it possible. Everything's still done the old-fashioned way with acrylic. So everybody wants are teeth that don't come out.
Okay. So how many implants for that? Like a lower full set of teeth?
As little as 4 implants.
Okay. What about the upper?
For the upper, we can do 4 as well, although I usually do 6 on the upper. But it's a similar process. We're able to do it in one day as well.